The following portion of Daytime is sponsored by Tampa General Hospital.
Today we're highlighting a common occurrence after prostate cancer that affects the daily lives and confidence of men who have their prostates removed. Urinary incontinence can continue for months or much longer. Joining us today with more on treatment and research is Dr. Trushar Patel, a urologist with the TGH Urology Institute and Associate Professor of Medicine with the USF Health Morsani College of Medicine. He also serves as the Director of Urologic Oncology and Robotic Surgery with USF Health. Doctor, welcome. It's good to have you here.
Well, thank you for having me. I appreciate the time.
I know that a lot of people probably don't realize how common this problem is after the prostate is removed. Can you explain why urinary incontinence happens and how long it typically lasts for patients?
Yeah, well, first of all, prostate cancer is actually very common. About 1 in 8 men are going to experience prostate cancer in their lives, and many men actually choose prostate cancer surgery for their treatment. Almost all men after surgery are going to have some element of incontinence, and about 10 to 30% of them can have long-term incontinence. Now, we're not talking about kind of turning on a faucet, we're talking about dribbling. So it's a significant problem that a lot of men can face after surgery.
Enter this device that is currently being studied nationwide, but TGH is the only site in Florida that's taking part in this study. What is this called? What does it do?
Yes, so this is the Levy Medical Veru scaffold. This is a suture scaffold that we can place at the time of surgery. And what it does, it creates a kind of sphincter control of the bladder. It kind of cinches it down to make it tighter, where we make the anastomosis at the time of surgery. And the goal of this trial is to see that if patients can have less leakage after surgery. And now, it is a randomized trial, so if you want to participate, there is a chance that you may get the control arm, which means you may not get it. But if you want to participate, USF and Tampa General are the only places in the state of Florida where you can get it.
Good to know. In the meantime, if you don't get to participate in this, what are some other treatment options for urinary incontinence?
Yeah, so it really starts with physical therapy. A lot of patients, we send them to physical therapy to strengthen their pelvic floor muscles, their sphincter control. So we start with there. And then now, if that fails, there are different surgical techniques that do include prosthetics that can help incontinence. But usually we wait about a year or so after surgery to kind of implement those.
I know that TGH and USF Morsani College of Medicine for a long time have been partners in academic research. Why does that partnership matter so much and serve the community so well?
Yeah, it's a really important partnership in the community. I take it very important to that we take care of the most complex patients in the community. We have a world-class hospital in Tampa General, and we have world-class faculty on the USF side. And when you combine them, we can offer patients some of the best care in the Tampa Bay region that most hospitals cannot do. And so we need both partnerships to kind of do this for our patients.
And as a doctor, I would like to end with this. Would you please speak to those men who have this problem after undergoing that surgery and feel maybe worried, helpless?
Yeah.
What would you say?
I will say that there are a lot of resources for you out there. Speak to your urologist, your primary care. If your urologist doesn't particularly partake in some of the treatment options that are available, you can come to USF or TGH for these available options. And so there are options for you. You don't have to live in silence with incontinence, and this can be rectified.
And those options are right in our own backyard, which is fantastic. Thank you, doctor.
Thank you very much.
Appreciate having you here. For more information, go to tgh.org/urology. Daytime, we'll be right back.
The preceding portion of Daytime was sponsored by Tampa General Hospital.